Inside the stories that affect you. This is Inside KELOLAND.
Good evening and welcome to Inside KELOLAND. I'm Angela Kennecke. Thank you so much for joining us. Earlier this month, KELOLAND Media Group and Avera announced the 15 nonprofit organizations that will receive the 2021 Avera Tradition of Caring in KELOLAND grants. Last week, we introduced you to 3 of those organizations, and this week, we are looking at 3 more. Tonight, we'll hear how the White Buffalo Calf Women's Society helps support and bring healing to victims of domestic violence. We'll also introduce you to the Center for the Prevention of Child Maltreatment and its mission to stop child sexual assault in South Dakota. Plus, we'll find out how the Helpline Center is helping people cope with the stress of the pandemic and the holiday season. But before we get to those topics, we are taking a look at COVID-19 beyond the numbers. When you hear that nearly 1,400 South Dakotans have died of COVID-19, it can seem like just another statistic until it hits home. A Crooks, South Dakota woman wanted to put a face to the struggle that so many people have with the coronavirus. It all began 3 months ago for Barb Myers. Tonight, we show you how the 69-year-old documented every step of her COVID-19 journey on Facebook.
She was passionate about a lot of things. She loved life.
Roger Myers says his wife of 16 years especially loved pets. This is her Morkie, Presley, and her Yorkie, Emily.
Eventually, Emily had a little stroke, and we had to put her down, but she saved her ashes.
Not only was Barb a pet person, she was a people person. Her latest retail job was at Shields as a cashier.
You didn't just check out with her. She made relationships.
Even though she was active, Barb suffered from asthma. COVID-19 hit her hard in the middle of October.
That she couldn't breathe.
Roger rushed her to the emergency room.
Basically, she was needing a lot of oxygen, almost 40 liters.
Barb began her Facebook diary of her hospitalization. On October 19th, she posted, "In hospital with COVID. Don't be afraid to test if you suspect it. Wear a mask, wash, sanitize, everything you can do for you and all those you are around. This is no picnic. In fact, it is horrible."
She was very, very vocal about that. And I think that's one of the reasons why she started to post, hey, wear your mask.
She wanted people to know the reality.
Exactly. That this is real. This is what's happening to me. And say, this could happen to you or your family members.
For the first 2 weeks, Barb was hospitalized. Roger wasn't allowed to visit her.
And she would text me, I'm having a good day. I'm having a bad day.
On October 22nd, she posted this. "Tried to have my pity party cry last night. Extremely difficult to breathe with oxygen running. Had to make a choice, so crying is not an option. The isolation is very difficult." A day later, she shared photos from her hospital room with her finger hooked up to an oxygen monitor. She thanked friends and family for their well wishes. "The depression has been really bad, and looking at all the balloons raises my spirits. Thank you all." Then, on October 25th, signs of hope. "Bit of color in my face, skin, breathing a bit easier." While she anticipated going home, she also issued a warning. "This has affected all areas of my body," she wrote. "Just a flu does not do this to you or your body."
This isn't a joke. People go through this every single day.
On October 27th, Barb wrote, "Hard night. The loneliness, isolation comes bearing down during those early hours. Contact consists of the fantastic staff, but they are not family you want around you. No one except another patient can understand these feelings." The next day, Barb was moved to Select Specialty Hospital, a 24-unit bed within Sanford Hospital that's run by a separate company. That's when Roger was allowed to visit her again during a 2-hour time frame once a day. On November 2nd, Barb posted a photo of herself with a nurse and a walker.
One of her proudest days was they were teaching her how to walk, getting her back into her walker.
Barb posted, "Help is necessary, but I am making it, and I will survive." Barb did better for a few days, but on November 5th, she posted a photo of her leg, which had turned color. Yet she was still positive she would be home by Christmas.
And the nurses, I can't speak enough for them.
Barb posted photos of the nurses she had grown close to during her long stay, but continued to yo-yo between hope and feeling worse. On her 4th week in the hospital, Barb wrote that she was missing her fur babies and my friends and so much at home. On November 13th, she shared with her followers what it was like during her 10 days in the ICU. It is tough since you are aware death can come at any time. To anyone in one of the rooms around you, you cry for the person as well as the family. Barb's last post was on December 5th. She wrote, "Third IV of the day. I did my exercises for my leg muscles. Eventually, they will start working properly again."
She was still, in my opinion, trying to get out of there.
Only 5 days later, Barb was dying. Roger was by her side with her other favorite companion.
And I got to bring Presley up there for, a couple of hours to be with her.
He also brought the ashes of her Yorkie, Emily.
You know they're going to a better place. You keep that in mind. You have to. And you're just there to escort. As an escort, and I brought as a help for Barb the ashes of Emily up there with her, because there's a little saying, "We'll meet again on the Rainbow Bridge."
The end of Barb's COVID-19 diary on Facebook included a live stream of her funeral.
You can help the family honor Barb as they raise a Smirnoff screwdriver in Barb's memory. Because if she were able, her family is fairly certain she'd announce that it is party time.
And December 4th marked Roger's and Barb's 16th wedding anniversary. Barb is survived by 3 adult children, 3 adult stepchildren, all of their spouses, as well as 9 biological and 3 step-grandchildren. As the pandemic continues, we are working to put a face to the hundreds of people who have died from the virus. We've put together a special page on KELOLAND.com. Just search Faces of COVID-19 in South Dakota on our website. Well, we are going to take a quick break. Coming up next, we'll hear from an organization on the Rosebud Reservation and how it is offering hope to victims of domestic violence and assault. Welcome back. White Buffalo Calf Women's Society on the Rosebud Reservation is a 2021 Tradition of Caring recipient. The organization provides services to victims of domestic violence, sexual assault, and dating violence. Joining us now is Executive Director Lindsay Compton. Thank you so much for being here, Lindsay.
Thanks for having us. We're really excited for the opportunity and to see what doors opens for the organization.
Tell me a little bit about how the White Buffalo Calf Women's Society came about and exactly what your organization does.
So our organization is a 501c3 nonprofit. It's primarily known for a domestic violence sexual assault shelter here on the Rosebud Sioux Indian Reservation. We also deliver out-of-shelter services, and we're really developing areas of response and aid to LGBTQ, education awareness, prevention, response and relief. And we also do a lot of training. We're looking into revitalizing that aspect of the organization that we're actually entering our 44th year of service here. And White Buffalo Calf Women's Society is the original domestic violence sexual assault shelter in Indian country. So it's very historic, not only on a local level, but truly on a national level. And we look forward to continuing to develop what that looks like in aid and response to MMIR, missing murdered Indigenous relatives, to our young women's and our young men's societies that we're developing to work with adolescent youth, and also what that looks like in aiding during the pandemic. It's really changed how we deliver our services, direct and non-direct.
Yeah, I want to get to that in just a moment, how you've had to kind of change what you do because of the pandemic. But first, I wanted to ask you about the need and what problems, what issues you see out there where your organization can step in and really help, like some direct programs or some direct services that you're doing.
Sure. Our direct services are, we have a shelter. We have a shelter that we operate a 24/7 facility. We can serve up to 36 individuals at a time. We operate primarily at a 90 to 100% capacity year-round. We are one of the only culturally responsive 24/7 direct service providers. Very unique. Oftentimes we get calls from police, ER, emergency response. So we get calls from them to be able to respond to a crisis situation, domestic violence, sexual assault, interfamily violence, what that looks like. And so we have our shelter, but then we also do out-of-shelter services, whether it's aiding in the need of an emergency service, such as food or clothing or wraparound care, referral services to the different partners, programs, and entities and tribal programs that we partner with and collaborate with and continue to strengthen and develop what that looks like. A part of our mission here is to really develop our staff as well, because a lot of our staff are survivors ourselves. And so what does that look like in developing staff for the community? So regardless of where they're at, whether they're here at White Buffalo Calf or they go on into another part in the community regionally, that they really are able to benefit from being a part of the society as a member, as a staff, and what that looks like. I would say that with our in-shelter services and our direct services, White Buffalo Calf Women's Society, we're the second largest victim service awardee for the state of South Dakota. So that's really huge. That's a huge thing. I believe last year we reported somewhere around 11,000 direct acts of service. And so that continues to grow. I'm entering my third year here, and we will continue to develop and refine what our data collection looks like. But I really also want to encourage, and we have a 800 national hotline. And so I'd really like to reach out to anybody who's in a situation of violence, coercion, control, or even just needs some advocacy. They can certainly reach out to us to our 800 line, 1-800-856-2317.
And that's fantastic, the incredible work you're doing there on the reservation. How much of a factor do drugs come into play with some of these situations? We know that meth has been a huge problem in all of South Dakota, but on the reservations as well.
That's the current reality that we face here on the reservation, not only on the reservation, but like you said, across the state, across the region, across the country. We really take an approach of compassion, a balance with accountability. So we know this is a reality of some of our clients and the people that we work with in out of shelter or in the community, that we don't use to judge, or services are never, ever denied if there's a factor in that. In fact, we just try to provide a level of advocacy and support as far as maybe we can help with treatment referrals, maybe we can help get to one of the many tribal, local, regional programs that can provide. If we have a gap in service or something we're not able to provide, we will certainly do everything that we can to connect the clients, which at our organization, we refer to clients as relatives. So we can connect the relative to the needed service upon an intake, an assessment, a needs assessment, cultural needs assessment. Those sorts of things will allow our advocates to work together as a team to be able to get the client relative connected to the resources that they need.
I love that term of relative. It really makes the person you're helping seem like they're just part of the family, right? And how have you had to maybe switch gears or do things a little differently because of COVID-19? And we know that many Native Americans have been affected by this virus as well on reservations. So what have you had to do differently?
We have had to take many steps to ensure the safety of our essential staff. We're definitely essential. We have taken steps to coordinate our intakes with the local Indian Health Service. So we are able to get our intake clients over to IHS to get tested. we have been allowed through some of our funding opportunities to be able to pay for some of these tests at our local clinic, where we've coordinated drive-through periodically, I'd say about once a quarter maybe, where all staff goes through, where our clients go through with staff, and really just try to utilize the resources from the systems that are in place immediately and trying to coordinate those efforts. We've also, of course, the only reason why I'm not having a on right now is to visit with you guys, and because I'm in my office, our admin offices are right here though in the shelter, so we deal with trauma crisis response daily. We have a mask mandate inside the shelter from old grandmas to itty bitties, so everyone's definitely very mindful of that, and we're looking towards things like getting I know we've talked about recently microwaves, hot plates, disposable utensils, and little mini fridges in each of the rooms. So those are different ways that we've responded. Thankfully, we were able to receive some of the CARES funding from FIPSA, a National Family Violence Prevention granting agency, where we are a sub-tribal recipient of that. And also directly from our tribal CARES funds, we were able to apply for some program funding for that, project funding. And so that's really opened a door for us. You know, we were, with that project, we were allocated and awarded 2 trailer houses, so sort of some isolation units, which are being developed right now. At the same time, we recently, so knowing that was coming in, we recently came forward to the tribe, came forward to TLE, Tribal Land Management of the tribe, and we're awarded 14 acres. That's really historical for our organization. The building that we're in currently, we've been in here since I think 92, I want to say. And so for us to now have 14 acres to develop with our isolation units first, and then for ground up hopeful studio links for our shelter. So we're really excited. And this in particular, this opportunity to be with you guys and then to continue with the commercial, I think that will be coming, will really allow us to, I think that's going to come just when we need it to really, what does this look like with those 14 acres to develop for the organization?
Well, that is exciting. I can't wait to follow this story. Thank you so much, Lindsay Compton from the White Buffalo Calf Society at the Rosebud Reservation. Thanks for joining us today.
Sure. Thank you, guys. Be safe.
Yeah, coming up next, we'll introduce you to another local organization that has committed to ending child abuse in South Dakota. In 2016, a report from the Jolene's Law Task Force estimated that at least 4,000 children in South Dakota experience sexual abuse every year. The Center for the Prevention of Child Maltreatment is committed to putting an end to that. Joining me now is Program Coordinator Christy Krantz. Thank you so much for being with us on Inside KELOLAND, Christy.
Thanks a ton for having us. We really appreciate it.
Thank you. First of all, tell me about your organization and your mission.
Yeah, you bet. So CPCM, Center for the Prevention of Child Maltreatment, was created really to carry forward that hard work that was done by Jolene's Law Task Force. It was a legislative task force back in 2014, and they were really tasked with studying specifically child sexual abuse in the state of South Dakota. And during their hard work, it became very clear that all forms of child maltreatment needed to be addressed. And so there was a very comprehensive 10-year plan that was written in order to decrease all forms of child maltreatment. And so in 2017, CPCM officially began as kind of that organization that would link all of the professionals together from across multiple disciplines in order to carry out that plan. So we collaborate with our advisory board members and agencies and communities statewide. The list is plentiful. So Department of Social Services, Department of Health and Education, UJS, tribal partners, law enforcement agencies, the legal community, and of course our child advocacy centers and other organizations working for kids. So ultimately we have 3 prongs, kind of a 3-pronged approach: knowing, responding, and preventing. And so it's really important that the more we know about the prevalence of the issues of child abuse and the impacts to children, both now and in the future, to them, will help us to then respond with evidence-based practices and working within our MDT units and with trauma-informed care to really promote the treatment and the healing, and really with the ultimate goal then of lastly preventing future abuse.
Right, we all want to see prevention, and it's so important to get everybody who works in this area kind of on the same page, it sounds like. But I understand that one of your goals is to build resilience in individuals and communities. What do you mean by that?
Yeah, good question. So one of our main areas is to help the community understand that there is hope and that child maltreatment is preventable. However, it really is important for our neighborhoods and our systems and our communities to work together to build the resiliency opportunities and to come together to help provide the necessary things in order to serve those who either have been harmed or to prevent that in the future. So some examples of that might include having a community coalition coming together and really asking, as a group, across many sectors, who are our mandatory reporters in our local community? Are they trained appropriately? Are our law enforcement officers and our medical professionals and our teachers all trauma informed and educated about this area? Do our healthcare facilities have sexual assault nurse examiners? And so on and so forth. And of course, access to services as well.
So training, prevention, treatment, you can't do one thing without the other, right?
Correct. The training piece is very important, and there are two main training components that I kind of wanted to touch on today, Angela, if that's okay with you. The one being the South Dakota ACEs and Resiliency Program. We know that ACEs, or adverse childhood experiences, can really cause ongoing issues, I would say, with not only children, but then as they move into adulthood. So it might be an acute instance of a trauma, or it might perhaps be a repetitive adversity that they experience. And what can happen, whether that be abuse or neglect, for the child, whether it be household challenges such as substance abuse or mental illness or divorce, having a household member incarcerated, all of those potential adverse childhood experiences can have some negative outcomes. We know that it can cause some mental health issues such as depression and anxiety. It can cause folks to participate in risky behavior with alcohol, drug use, unintended pregnancy, for example, HIV, STDs, and so on and so forth. And so we have a training program in partnership with Children's Home Society, and we have trained since 2018 over 15,000 people across the state of South Dakota. So it's a train the trainer model, and the goal is really to ensure that people are understanding the impacts of ACEs so that then we can move forward for the additional work in our state.
Well, that's amazing, and continue that good work, and we're so glad you're a recipient of this grant. We're going to take a quick break. Coming up, the Helpline Center wants to remind everyone they are just a phone call away and ready to help. We'll tell you about its 605 Strong program next. Well, I would reckon to say most of us have been under a lot of stress over the last months of the pandemic. Now, the holidays can make it even more stressful. That's why the Helpline Center wants to remind everyone they are just a phone call away and ready to help. Through its 605 Strong program, by calling into 211, you can talk with someone about what you're experiencing and get connected with long-term resources. That is all the time we have tonight. Join us every Sunday following our 10 o'clock news right here on KELOLAND TV for more on what's going on inside KELOLAND.